Thank you everybody for joining us and welcome to today's webinar, How to Win the Recruitment and Retention Battle for Medical Assistants. We are pleased to bring you this webcast presented by the National Health Career Association. We have a few important announcements before we begin. This webinar is being recorded. Next week, you'll receive an email with the recording link and other follow-up resources. This session is designed to be interactive, and we encourage you to ask questions during the event. You can submit questions by typing them in the Q&A or in the chat box. Our team will do our best to address all questions. And in the event we don't answer your question today, please know we'll follow up with you personally after the webinar. Again, thank you for joining us today. My name is Lauren Pisa, and I'm in business development at the National Health Career Association. A little background on NHA. We are the largest allied health certification agency in the nation, offering 8 fully accredited national certification exams for both clinical and administrative professionals, such as medical assistants, phlebotomy, EKG, electronic health records, patient care technician, pharmacy technicians, billing and coding specialists, and medical administrative assistants. As a provider of certification exams for over 30 years, we have listened to the market and have evolved to provide learning resources to help fill industry demand. Resources such as soft skills training via virtual simulation, motivational interviewing, and patient engagement training that includes virtual simulation, and training for those practices operating in or getting ready to transition to a patient-centered care model. Which leads us here today. NHA works closely with educational institutions and healthcare employers across the country to certify staff and train staff for career laddering opportunities. Again, thank you for joining us today. Let me first introduce you to today's speakers. Crystal Bunke has had the opportunity over the past 10 years to collaborate with educators and employers throughout the country as it relates to the evolution of the MA role. She is excited to share experience throughout the time together today and provide ideas on how to reimagine your medical assistant strategy. Kayla Steffen has also worked closely with healthcare educators and employers across the nation for over 15 years to implement training, recruitment, retention, and professional development initiatives. She will share some best practices and tried and true methods to help bridge any gaps and empower medical assistants to access a better future. Thank you. And once again, thank you for joining. And at this time, I'm going to hand it over to Crystal.
Awesome. Thank you, Lauren. I'm excited to be here today. And throughout this webinar, you can expect us to talk about 3 core topics. The first one being just what is the medical assistant state of the union? We are hearing there's challenge in hiring medical assistants, retaining medical assistants. So what is driving all of that? The second thing we're going to talk about are strategic recommendations for you all as employers to recruit top MA talent. What can you be doing to make sure that you're getting a good pipeline of medical assistants applying for your roles? And then the last thing is ways you can take control by by organically creating a pipeline of medical assistant talent within your organization. For instance, how do you take a CNA to become a medical assistant? Or how do you create a career ladder for your medical assistants? So those are all the things that we'll talk about throughout today's webinar. But first, let's meet the group. Before we fully engage in the content of this webinar, I would love your feedback. So take a moment to complete this poll. Do you recruit medical assistants, educate medical assistants, or manage medical assistants? I'll give you a couple seconds to answer. All right, we'll go ahead and close the poll. So no matter how you answered that question, we have content for you. We have content for every role listed. So just listen carefully and many things will apply to you. All right, so first let's talk about the state of the union. Over the past decade, I've had the wonderful opportunity to speak with physicians, and they all say the same thing. They cannot do their jobs well without highly qualified medical assistants. They are critical care team members, and they just cannot proceed in a good clinic flow without medical assistants. Medical assistants are also vital assets to enhancing clinical outcomes, efficiency, and also bring the joy back into practice for these physicians. They are critical care team members. But despite being vital assets, there continues to be a shortage of medical assistants in the United States, and that's caused by three primary core reasons. The first is there's an increase in volume of need of medical assistance as the United States transforms to this patient-centered care or team-based care model. In this new model, the ratio of physicians to medical assistant is oftentimes, one physician for 2 medical assistants, or 1 physician for 2.5 medical assistants. And this is different than the traditional staffing models of 1-to-1, 1 physician to 1 medical assistant. So this model alone almost doubles or nearly triples the need for medical assistants in the United States. The second is since 2014, the medical assistant graduates in the United States have suffered a significant decline. Part of this is due to school closures, decrease in enrollment, but there are just not the same number of medical assistants entering the workforce on an annual basis. And all of this, despite the fact that the Bureau of Labor Statistics is citing a 23% job growth in the medical assistant profession. So economically speaking, there's an increase in need of medical assistants. There's a decrease in supply, and that is where we are. That is the medical assistants state of the union. We need more medical assistants, and you all can do some things to help get more medical assistants in the door and retain them. But that is, the top 2 reasons as to why there's a need for medical assistance. Now, the third reason is there is also a citing of higher than normal turnover rates the past 18 months or even 20 months. So burnout since COVID has reached an all-time high, and that's contributing to critical staff shortages. So financially speaking, let's talk about this. The medical assistant turnover is expensive. The cost of turnover on average is about $14,000 per medical assistant, which is about 40% of their annual salary. So theoretically, if you have 100 medical assistants with a 40% turnover every year, that equates to a total expense of $1.4 million annually. That's a big number. And there, again, are things you can be doing to make sure that you retain your medical assistants. So the first step in generating change is just to be educated and aware. The great news is that these obstacles that I outlined in the State of the Union have innovative opportunities for employers, educators, and even medical assistants. So an obstacle is often an unrecognized opportunity. And I believe these obstacles are leading to the overall opportunity to highlight the medical assistant profession. MAs are emerging from the shadows, and there are things you can be doing to proactively address these inevitable challenges that you are going to face. So let's dive into the solutions. We talked about what we're experiencing, but really, what can you do about it? The initial recommendation is around the recruitment of top medical assistant talent. So the first step in recruiting top talent is to take advantage of the opportunity to work with local medical assistant schools and programs, especially those that grad the highest number of medical assistants on an annual basis. And if you don't know where to start, just call a school. You could Google, what's a medical assistant school in your area or medical assistant program. Call a school, ask for career placement directors or career placement services. Those people are ultimately in place to help graduates get a job after graduation. So that is your first start. And if they can't help you, they at least can point you in the right direction. So ensuring top talent is applying for your open jobs first should really be a strategic initiative of your organization. And then when you get on a call, the other thing you want to talk about is ensure you discuss the importance of medical assistant certification. So as we all know, certification helps medical assistants work at the top of their skill sets. It also helps physicians trust the medical assistants that they will lean on in day-to-day clinic activities. So employers are either requiring certification upon hire or shortly after. Sometimes we're seeing 90 days or 120 days. So no matter what, certification is important. And this is backed by a recent statistics that suggests that 88% of employers require medical assistance upon hire. Require medical assistant certification upon hire or shortly after. So again, when you get in front of these schools and you encourage those schools to have the students apply for jobs at your organization, also encourage those students to get certified, earn a national credential prior to graduation. Many students do not know, or even educators, do not know how important this is. And I'm going to share a personal story of a student I worked with as to why. So this is Jennifer. She's a single mom. She just started her first job as a medical assistant. And she unfortunately did not earn a national certification prior to her employment. So she has been instructed by a local employer that she has to earn her national certification within 90 days to remain employed. So at this point, she's trying to learn a new job, she's caring for her family, and she's trying to study for the exam while no longer being in that academic mindset. So I'll pause for a minute. What words come to mind as you think about Jennifer's situation? Yeah, for me, it's stressed, it's scared, it's overwhelmed. She has a lot riding on the fact that she must obtain that certification to remain employed. And this could also lead to thoughts of, hey, should I just quit? Should I give up? Should I go do something else? I mean, we never want our new hires to feel that way. So the good news is this does not have to be the norm. Make sure your schools, again, know the importance of these students getting certified prior to graduation. And in return, this could help limit turnover within your organization upon hire. The second thing that you can do as it relates to recruiting students, right? We already talked about getting a partnership with a local school or local schools, making sure those students know to get certified. The third thing is review your job descriptions to make sure you're not unintentionally causing qualified medical assistants to not even attempt to apply for a job within your organization. But before I discuss that in more detail, let's take another poll. How often does your organization review job descriptions to ensure the largest accredited certification providers are listed? Is it every 90 days, every 6 months, every year, or every couple of years? I'll give you about 5 seconds to answer. Awesome. Thank you so much for answering that poll. Looks like most of you are leaning toward every year. Very good. Well, going back to the comment I made about the thought of unintentionally causing qualified medical assistants to not even apply for a job within your organization, you can see that if you do not list all the accredited medical assistant certification providers within your job description, you may significantly be limiting the number of qualified medical assistants that apply for an open rec at your organization. So for instance, if I'm a medical assistant and I only have obtained one of these certifications that may not be listed, I'll go to the job description and be like, oh, they don't accept me, and just move on. And that's not what you want. So please, please make sure that all those accredited certification agencies are listed in your job descriptions, including NHA's CCMA exam as well. and then make those updates as soon as possible. And for reference, this is an example of all the NCCA accredited medical assistant credentials that should be listed on your job descriptions. Most employers list MA credentials under the requirements section of the job posting. And this is your all-inclusive list. So feel free to take a screenshot. Again, you will get a recording after this, so you'll be able to access it once again. But this is your list. Make sure you don't leave anybody out. And make sure that you get as many medical assistants applying for your jobs as fast as possible. So at this time, I'm going to hand it over to Kayla, and she's going to discuss ways that she can talk about organically creating that medical assistant talent within your organization.
Awesome. Very good, Crystal. Thank you so much. Crystal outlined some really excellent ways to recruit much needed talent. And so I'm going to expand on that just a little bit deeper here. So we're first going to talk about bridge programs, and I'll start by breaking down the different pathways that a bridge program can take. So the first pathway is through a traditional education program at either a community college or a trade school, a career college. These typically range anywhere from about 9 to 18 months and will include some form of clinical externship or capstone course and tend to result in the learner's eligibility to sit for one of those national certification exams that Crystal just mentioned. The second pathway is through workforce programs. So workforce programs are occupational training opportunities sponsored or funded through the Department of Labor at state and national levels. These are typically shorter programs, but they're fully integrated into the workforce, meaning that a student that's taking the didactic portion and they're getting the on-the-job training at the same time. The final option, and this is where we'll spend a bulk of our time here, is an employer-based program. So this can happen in one of two ways. One, the employer can develop their own training program that includes the didactic content and the didactic content teaches the medical assistant and then provides the direct hands-on experience there in the healthcare system. This is usually self-funded through internal investment, maybe through some grant money. The other way that employers can develop their own training program is to develop a direct or exclusive partnership with a school. Think like a community college workforce side, like the non-credit side of a community college, or there's a lot of career colleges that you can reach out to as well. Really anyone right now is kind of flexible, or they're becoming more flexible in how they offer some of these exclusive partnerships or customized trainings for employers. So this will look similar to a workforce or an apprenticeship model, but it's typically privately funded or managed internally. So we'll zoom in a little bit closer to these two employer-based options. And the first aligns with many of the scenarios that we've already mentioned that Crystal talked about, in which you partner with an existing educational institution. So those schools and programs hire instructors, they provide that classroom training content, and then your organization will provide the hands-on portion of the program. This provides a great bridge from school to employment. It essentially allows the employers to have that opportunity to evaluate these potential employees on the job. We really recommend partnering with educators to offer these exclusive or customized training pipelines if you don't have the internal bandwidth to do something on your own. Not everyone has an internal training staff, or maybe your internal training staff doesn't have the bandwidth to do something like this. And so this is a good pathway if that's something that rings true for your organization. The next is this full in-house development. And again, it works well for those healthcare employers that do have the capacity. Maybe you have nurse educators, or you have a full team that can be dedicated to training. There typically isn't as much upfront investment as in developing these programs. Your team can align the content to your system or your practices initiatives, to your scope of work, to your best practices. And the ultimate goal here is that you can train your own medical assistants. You have more quality control. You can develop these deep, loyal employees who are committed to the success of your organization. I find that Kelly Aiken says it best. And when she said that the front line, when the front line is better trained and has career advancement opportunities within the organization, there's a direct correlation to improved patient care and improved patient satisfaction. And I truly believe this. We just reviewed a number of different avenues of collaboration with educational partners and workforce opportunities, which we've seen firsthand lead to an increase in a qualified candidate pipeline. But there's an even greater impact opportunity here. When you increase these educational partnerships, you improve the quality of your candidates, which improves patient satisfaction, patient outcomes, which I think is the goal for all of us, really. So Crystal and I also constantly and consistently hear that retention is a challenge. So we've talked a lot about recruiting medical assistants. So now how do we keep those? It's estimated that there's over 500,000 medical assistants working in the United States, and we have a 40% turnover of MAs on an annual basis. And Crystal outlined the expense of that. It's expensive, $14,200 to recruit a medical assistant. Take 50,000 or 500,000 times 40% times 14,200, and that's expensive. Very high cost to employers. So through our partnerships here at NHA, we're finding that retention tends to increase when employers purchase certification for their employed non-certified MAs. And they create career ladders by providing training and upskilling opportunities for them, which again, we'll talk about here shortly. The opportunity to invest in your medical assistants makes them feel important. It makes them feel valued. They take pride in earning credentials behind their name, and they feel more of a sense of loyalty to the employer that shows their investment and shows them a career pathway within their organization. Again, that's really important. We can constantly be focused on recruitment, but if we don't focus on how can we keep them and develop that sense of loyalty and develop them within our organization, we're always going to have a recruitment problem, right? Because our turnover is going to continue to remain high. So how can we put focus on both of these things? And that really leads us into career laddering. So recruiting top talent and providing professionals this growth leads to enhanced retention, increased productivity, and can help manage risk along the way as well. So let's just see where our audience here today stands with career ladders. So a simple poll question should be popping on the screen here. Just very simply, do you have a career ladder in your organization? Yes, no, and if you don't know, that's okay too. We'll give it a few seconds here. I'm seeing most, yeah, we can go ahead and end the poll here. We're a little balanced. Yeah, most have some type of a career ladder in place for your medical assistants. That's great, very good. So moving into, and I still have the poll on my screen here, there we go. So moving into really before you can start planning these training options, you want to identify what does a career pathway and a career ladder look like in your organization? For incoming medical assistants or those wanting to become a medical assistant. So on the next slide here, you'll see an example of a career ladder or an advancement opportunity. It's recommended that as MAs progress through each step that they experience an increase in pay as well. I think that's something that's pretty standard and understood. That's something that we've seen be popular. So step number one could simply be obtaining a medical assistant certification from an accredited certification agency, one that Crystal mentioned on the last slide of her presentation. This allows you as the employer the added benefit of ensuring quality and safety in your clinics. And again, as Crystal mentioned, we have found that physician confidence in medical assistants also tends to increase when MAs are certified. Step two could be expanding that medical assistant scope of work. So allowing the medical assistant to take on additional tasks. Maybe it's scribing, maybe it's health coaching, maybe it's some type of flow management, but what trainings can we provide to that medical assistant to upskill them to be able to take on and really expand in their scope of work? A third step could be promoting that MA to a team lead role. In this role, maybe the MA can lead team huddles or they could train other MAs. This allows the MA also to help ensure that that physician is in flow and on time. And we've learned from our employer partners that not only does retention increase with this standardized career ladder in place, but also patient satisfaction scores tend to increase because we pull that burden off the physicians, and whether it's through the adoption of roles like the team lead roles, et cetera. So everyone is able to truly work at the top of their skill set. One at Analytics, also known as Talent Neuron, has published some information about medical assistant salaries based on years of experience. So as you can see, across the country, organizations are developing pay scales based on experience. But as we discuss training programs and career ladders, you'll want to consider, what else do you make a priority in your organization? That might look different from you. How can you incentivize your staff, and how can you incentivize them to advance in their roles? And how do you develop them into high performing, contributing team members in your organization? So yeah, pay is part of it, but maybe it's something else. So they're all things to consider as part of this development. On the next slide here again, maybe it's pay, maybe it's study time, maybe there's some different other support systems that you'll put into place. So a lot of things to consider as you're developing these strategies. So at this time, I will tell a story about how an employer that created a career ladder to provide career advancements for their medical assistant team members, if they were to become certified, kind of a story about their success or non-success at first with that. So this employer put something into place. So their employees or their MA started out as an MA1. And upon certification, just like we saw in the ladder, they would grow to an MA2. And there were some other benchmarks for climbing up that ladder. So after having this system in place for years, the organization realized that there's only about 16 team members that actually took advantage of this opportunity. And they're a large health system. They're very large. And so the employer reached out to their staff and they just said, hey, what barriers are you experiencing that would prevent you from taking advantage of this opportunities? And the medical assistant shared that, first of all, we don't have the ability to pay for that certification up front, even if we're being reimbursed. That's going to put us in a position where we have to make a difficult decision for our family that week, right? So I might not be able to afford groceries that week, even though the cost is not that much for most certifications. It's still a difficult thing for a lot of MAs to pay for up front. So let alone, I don't know if I'm going to find the time to study or if I'm going to be able to have the structures in place that I really need to be successful. So that led this employer to reach out to NHA. So we partnered together with this employer to create an embedded MA certification program. So the employer provided the upfront cost for their staff to obtain their certification. They used NHA's outlines and pacing guides and communication templates to facilitate this process. They provided the candidates an in-house coach to support them through the study and preparation process. They even gifted them with 3 hours of on-the-clock study time each week. And the employers started, they said, hey, we're just going to start with about 100. We'll release 100 of these and see how things go. And within minutes of the registration time, there were more applicants than what they had seats for. And so to this date, the organization has certified over 300 medical assistants through NHA across their organization. By having the appropriate supports in place, they have over a 95% pass rate on the CCMA exam on their first attempt. So again, the appropriate support and the investment and the communication to their medical assistants. Many of them didn't even know that this opportunity existed. The communication early upon hire that there's a pathway for you here. Here's what it looks like, and we're investing in this for you was really key to standing these medical assistants up for success. Now, we know when considering any type of investment, it's really important that you have some data points in mind. So prior to their partnership with NHA, their MA turnover was in the 75th percentile. Within 1 year of starting this new support structure, this new communication plan, MA turnover was at the 10th percentile, which is practically unheard of to see this drastic of a change in such a positive direction. And not only did they see this change, but they've maintained it. So throughout our partnership with them, and we continue today, they've maintained turnover between the 10th and 12th percentile, which again is fantastic. And they've seen job vacancies in this MA position decrease in total by 43%. So these lower turnover rates indicated that not only did they hire MAs, but they retained them by giving them a reason to stay. Everyone understood from day one that I have a career progression, I feel invested in, and I can ultimately stay within this organization. So that leads us to, how do we get started? It can be overwhelming, it can be intimidating, and none of us have enough hours in the day to actually develop these career ladders sometimes. And so we are here to help. There is on your screen kind of a simplified outline of what steps need to happen, and I'll kind of briefly walk through these. So the first thing to do is just identify your motive. What are your goals? Hopefully we've provided some of that here today, but think along the lines of increasing retention and increasing the quality of your medical assistants in their training. The second thing is to put together your baseline competencies. We showed you the MA's levels that were reported by Wanted Analytics based on years of experience. You saw some great recommendations from one of our employer partners. So determine, do those things align with your system? Are there maybe some additional skills or maybe micro credentials that you would want to include in your steps? For example, and Lauren mentioned this at the beginning, NHA has a softer essential skills training for healthcare professionals, specifically medical assistants. We have things like motivational interviewing training to help better engage patients. And we have a learning resource and training on team-based care for those of you that are operating in that setting. Next is to outline the career ladder. And the great news is that if you haven't already gotten started on your career ladder, we'll provide you with a sample outline that you can use and follow up into today's call. And I want to mention too, sometimes, and many of you mentioned, we do have a career ladder in place. Sometimes it's not about changing it completely. Maybe it's just reimagining it. Maybe it's a matter of just communicating it. Maybe it's a matter of just thinking through, do our employees know about this? And is there anything else that we can do to help set them up for success to where they can get started? Maybe it is an upfront investment. What would that look like? So there's a couple of things to think through with that. The next phase will be the design phase, which is very specific to your organization, but this is where you get the final buy-in from all stakeholders and really determine this ROI. So you'll identify the team that will be a part of the education and the implementation process. And again, I think this is a really exciting part. You likely already have job descriptions in place, but once the program's been formalized, you want to ensure that these job descriptions and opportunities reflect the appropriate language and are applicable to these roles that you've developed. Getting closer to implementation, you'll educate the leader. So think here about practice managers, recruiters. Many of you on the line will be a part of that process. You'll be key players in getting buy-in from your medical assistants to this process. You'll often field the questions. So having an internal FAQ or maybe a one-pager available that outlines this process could be really helpful. And then finally is making that formal announcement, really generating excitement. This is an awesome opportunity for your medical assistant team to think big picture in terms of what's next for them and really give them the motivation to be committed to your organization. That's critical. So maybe you can assign like champions from within your pool of MAs to be maybe some peer leaders and truly lead the way here. But again, this is such a positive message. And it gives everyone the opportunity to feel invested in and to create some really positive excitement. The bottom line here is that it's often going to take several of the strategies that we've talked through today to both recruit and retain medical assistants. It takes everyone working together with the understanding that this gap here is significant and there's room at the table for everyone. And it'll take everyone to help fill the demand that we're seeing in the profession right now. But by working together, we can empower medical assistants to access a better future and ultimately impact the bottom line, which is improved patient care. So at this time, I will turn things back over to Lauren. I really appreciate your time today. While Lauren is wrapping things up, I really highly encourage anyone to type any questions that you have into the chat, and we will address as many of those as we possibly can here as to close up our presentation. Thanks again for your time. Lauren, back over to you.
Well, thank you, Kayla, and thank you, Crystal, for your insights. That was incredibly valuable. I'd like to leave you with 3 takeaways. First, keep the dialogue open and find ways to continue to grow your MAs. Second, make sure you're not limiting your candidate pool and include all accredited certification exams in job descriptions. And third, be aware of the trends that impact your MAs. Upon the close of this webinar, you should see a link to a quick survey. You can access the link via the chat. It's going to be posted in there now. And if you'd like to participate, click the link and it will open to another browser. You don't have to answer these now. You can answer them later, and you might be eligible for a $50 Amazon gift card for answering. Okay, so at this time, I'd like to invite you to please type any questions that you have in the chat, and we're going to do our best to address those as we round out our time together. Melody will read questions out loud.
Thank you, Lauren. This is Melody. I had actually a really great question that came in from Michelle. And Michelle asked, do you ever take a role, and I'm assuming NHA, does NHA ever take a role in connecting employers with NHA educators in their area?
Yeah, so this is Crystal, and I'm happy to answer that. We would love to. We have really strong relationships with both educators as well as employers, and we would love to be that connector. So in follow-up, if you would like any assistance from NHA, I'll ask somebody who is running the NHA chat to put this in, but you can actually go to nhanow.com and fill out a form requesting additional information, and we are happy to connect you with a local educator. So the NHA staff running it, thank you, Kayla. Thank you for putting that in there. Fill out the form, and we're happy to do so.
Excellent. Floyd posed a really great question, and in our employer webinars that we do, this is the first time this has been asked. I think it's a great question, Floyd. He asked, are we finding that the shortage is being caused as a result of fear due to the pandemic? For example, instead of becoming an MA, they're choosing a different go-to instead of the MA route just because they perceive it to be safer.
So I can certainly jump in with my experience, and then, Kayla, if you can add to this. I think we were seeing a shortage of medical assistants even prior to COVID, right? But I certainly think there are definitely elements of COVID that have escalated the current situation, perhaps that being one of them. So I think, there's multiple macro factors impacting the shortage of medical assistants, but we certainly started to see this trend prior to COVID.
Yeah, we were talking about recruitment and retention before this happened, and I think even pre-pandemic, the employer that I gave the example of with the career ladder, that was several years prior to the pandemic, and so I think it's kind of this perfect storm is what some of the things that we're seeing now. Is maybe there was starting to be a shortage. Sometimes there wasn't this career ladder in place, or there wasn't advancement opportunities in place for MAs. And so they were shifting out of the profession or finding something a little bit different. So that's been an ongoing kind of challenge in the industry. Enter the pandemic. And I think just some hard truths too are, maybe, it's not safe for me. And so I think that can be a fear, or I think the other thing just to be honest about is a majority, not all, but a majority of medical assistants tend to be women. I think if we're just honest about that. And so maybe the lack of childcare or the shifting things that we've seen with the need for childcare, or my kids weren't in school or whatever that looks like. I think the other thing is sometimes pay. Right now, when we have a minimum wage that's fairly high, we can see just I can make more at working somewhere else, and I don't need to go to school to do that because I can't afford it. So there's a lot of different things that come into play. And so again, it was happening before, and certainly the pandemic kind of escalated that a little bit. Again, the good news is, as Crystal mentioned, there is opportunity here for us to really look at the profession and for us to invest in the profession and to invest in these incredibly important professionals. So there's a lot of opportunity for us to reevaluate and to invest in these awesome folks.
Great. There are questions flying in right now, and I'm so excited to see that. I'm going to try to get to everyone's, but I'm going to jump down to a particular question that Joni posed, because she's getting a lot of responses from her colleagues on this call as well. So Joni asked or says, we're focusing on community-based training approaches. We have MAs come out of school certified and have no clue how to put their skills into practice. We're finding that they need more hands-on time during their training. Are others experiencing this as well? She's being inundated with questions that they're also experiencing that, Kayla. So can you kind of share some tidbits and points on how the opportunities for our today's MAs to get more hands-on experience?
So I'll jump in here. I think, well, first and foremost, it's super critical that if you have the opportunity to join any educator advisory boards, that you do so. Oftentimes, in my experience, educators may not know the gaps that you're truly experiencing once a graduate enters your program. Now, with that being said, we are certainly aware of those gaps and speaking with employers. And sometimes it's not just lengthening the program. Sometimes it's completely pivoting some of the content these educators are teaching. And I think, again, going back to the advisory board, that's where I highly recommend engagement from employers, because there might be some content areas within a program that don't necessarily need to be covered in the depth in which the local school is covering it. And in fact, perhaps MA clinical skills is where they really should be spending their time. How do you take manual blood pressures? So I think there's a little bit of an element of, I don't necessarily agree that it's lengthening the program. It's definitely being very clear that there's some content changes that need to happen.
Yep, I would agree, Crystal. It's if you can get a voice on an advisory board, I think that is probably the number one recommendation that I would have to say. Again, it's not about adding time to a program. It's about reevaluating what we're teaching to make sure that it's aligned to your needs. NHA also is aligned to this as well. We hear from educators, we work with educators and employers. And so we develop resources that are based off of employer feedback. We want to make sure that we're preparing job ready candidates through our resources. So whether it's a medical terminology in anatomy and physiology, or we are releasing a new medical assistant skills builder, which is focused on the clinical skills for medical assistants to allow them this interactive practice of these skills in a safe environment to really scrub and polish those things, identify maybe those areas of weakness before they come onto the job or their externship or whatever that is, or to supplement that externship experience. And so we have some resources in place based off of exactly what you're saying. It's all based off of employer feedback. We want to identify these skills gaps that you're experiencing and help polish those things, to work with educators to say, here's something that you can maybe offer your students to help fill some of this need that you're seeing. And so we're here in the middle, and we hear from both educators and employers. We're uniquely positioned. And again, if you would like to be connected to an advisory board, we're happy to connect you with your local schools. We have some resources and tools in place as well that can help polish any of those skills that might be lacking.
Great. Thank you, both of you. Other questions are flying in. Michael posed a question. He shared, our organization has increased pay and created an MA career ladder tier structure. And yet many MAs are still leaving for other and different opportunities at an increasing rate as we as a company try growing at a steady pace. Do you have any recommendations for a company that does not require certification and can train on vitals, but not phlebotomy skills?
So trying to understand the full question here. And I'm making sure that I didn't space out in the middle of that. And I'm pulling it up here on my screen also. So yeah, I think I would go back to some of the resources that I just mentioned, and I don't want to make it a sales pitch for NHA. But what I would say is that we have some tools and resources, again, that are based off of gaps that you're seeing, and happy to have a separate conversation about that. Again, I don't want to make it an NHA sales pitch by any means, but for whoever posed that question, would love to engage with you after to talk about how we can maybe help bridge some of those gaps with you.
And I'll jump in here too, because I think this often leads to a conversation I have with employers around their career ladder. So not necessarily an answer direct, but I think the other question I would have here is what does your career ladder look like? Is it really time intensive? Is it manual? And what are some of those things that and therefore, right, many medical assistants opt not to enter the career ladder because they're waiting on, a preceptor to assist who's time strapped. So I think the other thing to consider when you build up your career ladder or you evaluate your career ladder, is it scalable? Can medical assistants truly get through it in the time in which they desire to do so and not have to wait on others' availability? So I think, when I read the question, I heard the question, I think I personally have a lot of questions around what does your career ladder look like, and maybe different ways to position it and make it more scalable so the medical assistants really can take advantage of it.
Great, thank you. Gloria actually shared an idea that they're doing where she is. So Gloria said, we've had to create an extended, enhanced new hire orientation for newly graded MAs to include an extra 16 hours skills day where they did simulation prior to sending them off to their sites. We've also created and expanded an internal clinical training team that offers at the elbow support for new hires in the office if requested by the manager. So I thought it was just, since we also like to collaborate on these calls, I thought it was a great idea that Gloria shared. So thank you for sharing, Gloria. Lindsay posed a question as well. So Lindsay said, we're a pediatric clinic that is very understaffed and struggling to find MAs that have vaccination schedule experience. I'm looking at creating an internal training. Have you heard of any plans to develop this skill need?
I'm off mute. Sorry, I was looking for the mute button and I'm off. So yes, certainly something that we have heard come up. And again, NHA is always looking to stay closely aligned with the needs of employers and the evolving changes in our industry, and vaccination and that skill set is certainly something that's top of mind in the industry right now. So yeah, yes, we do have some training resources that can help to address that. There might be some professional development as well. I would also, again, encourage the alignment with your local education institution to see if that's something that they could look at plugging into their curriculum. Again, to Crystal's point, that's where your voice as part of the advisory boards can be very valuable to those organizations to make sure that they're producing candidates with that skill set.
Another thing here is scope of practice per state by state is kind of all over the board. So as Kayla mentioned, the educator side, this is definitely one of those areas I recommend connecting with a local educator and telling them that, hey, this is the need that I have, because many educators actually don't think medical assistants are allowed by scope of practice to do any sort of injections or vaccination. Coupled with the fact that I know there's a few states that also have emergency declarations that allow medical assistants to perform some of these procedures as well. So I agree with Kayla. This is a great opportunity to connect with some local educators, make them aware of some of the things that you are allowing medical assistants to do. Again, if they are allowed to do it within your organization.
Great. I've kind of grouped these last three questions together because they are all statistic in nature. They're asking for statistics. So it may not be an answer we have live right now. It may require an offline response, but I'm going to pose them anyway, Kayla and Crystal. Denise asked, do we have any stats on community practices not associated to a medical system losing MAs to a health system because they can pay more?
Unfortunately, off the top of my head, I don't. We typically run our macro level medical assistant data across all work environments, not specified down to one, but certainly something that we can look into, and if we can find it and follow up, it could be part of the next email that you receive post attending this meeting. So let us see if we can drill in on that answer.
Thank you. Thank you for asking, Denise, as well. So the last two questions came in from an anonymous attendee, but the question was, do we have statistics in the enrollment of students who are going to MA schools? Are we seeing a decrease or an increase, or what are we seeing in enrollment trends?
Yeah, so since 2014, there's been a decrease of, I don't know about enrollments, but I would say graduation rates for medical assistants have significantly declined since 2014. And that again is due to school closures. Some of the largest medical assistant schools in the United States have shut down over the past 5 years, program closures, and just schools citing a decrease in enrollment. So in general, yes, we're experiencing a decline of graduates over a number of years.
Thank you. And I think the final question I'm seeing here, I see 4 new messages. So we'll see what we have time for as we wrap this up. But also posed anonymously, just asking if we're seeing a decrease or an increase in certified medical assistants who are not renewing their certifications.
I can't answer that holistically, right? So there's us, the National Health Career Association. Then there's a handful of other certification agencies. So I can't speak holistically. I have no access into their recertification. But I think from an NHA side, that's, I think we're holding steady. Nothing alarming by any means, but that's only from NHA. I can't speak to the other agencies.
Perfect. So there are others that have come in, have just been some great collaboration amongst colleagues in the chat, but I think we may, unless I inadvertently overlooked someone, if I did, I openly apologize, but it looks like we've kind of covered questions posed in the chat, Crystal.
We will be capturing the chat as well. So if there's anything we did miss, we'll go back and try to provide a personal response. Thanks, great questions.
Yes. So thank you, everybody. I do want to remind you that you can expect a follow-up email within the next week that includes a recording of today's presentation, as well as a sample career ladder outline and how to contact Crystal and Kayla. Thank you so much for your time, everybody. Thank you. Have a good day.
Take care, everyone. Thank you.
Thank you. Have a great day.